The fourth performance enhancing drug that we will be talking about are narcotic analgesics and cannabinoids. So, how do they work? Cannabinoids and narcotic analgesics are used to relax muscles in the body and to reduce pain as well. They allow athletes to train with an injury by limiting the pain. Narcotics function by having an effect on the nervous system. They bind to opioid receptors in the body and block the excitatory neurotransmitters that cause pain. Cannabinoids work in a similar but very different way. The THC present in them binds to the cannabinoid receptors in the nervous system, and the CBD in the cannabinoids blocks the inflammatory mediators. By doing this, swelling is reduced, and CBD also causes a relaxation, so pain is reduced as well. Narcotics and cannabinoids have separate side effects. The side effects of narcotics are that they are extremely addictive. They give a false sense of invincibility, creating further injury as athletes continue to train on their injury. They also cause a decreased heart rate, constipation, drowsiness, nausea and vomiting, restlessness, muscle and bone pain, insomnia, cold flashes. Narcotic examples are opioids, morphine, oxycodone, and fentanyl. There are many more as well. The side effects of cannabinoids are often confusion, sleepiness, and anxiety. They are also harmful to memory, intelligence, concentration, and the ability to think and make decisions. Cannabinoids are all forms of cannabis products. The next drug that we will be talking about are peptide hormones. Peptide hormones are human growth hormones that increase the testosterone production levels. Testosterone is a naturally occurring hormone in humans, with much higher levels found in males. Testosterone builds muscle mass. Another peptide hormone is called erythropoietin. This increases the rate of red blood cells mature, which raises the amount of red blood cells in the body and in the interim increases the amount of hemoglobin. Therefore, athletes using this peptide hormones can hold more oxygen, thus fueling the body cells and muscles quicker with oxygen. This often reduces muscle fatigue and increases energy and endurance. The side effects of peptide hormones are related to many side effects, including increased water retention, increased hunger, dry mouth, tingling or numbness, high blood pressure, kidney pain, joint pain, weight loss or gain, and decreased fertility. Next, we will be talking about blood doping. Blood doping has recently become one of the newest big things for performance enhancing drugs, but it is a very dangerous one. Blood doping is when blood is taken from the body and then injected at a later time, or it can also be done through blood transfusions. What this does is it raises oxygen levels and hemoglobin in the athlete's blood. So, if you think of it, your body, you take out the blood, and then your body has to regenerate all that blood it created. So, when you add it back in after, you are overloading your body with the blood and the hemoglobin. So a greater supply of oxygen is able to be transported to the muscles. This is increases endurance and reduces fatigue. This is really popular in like endurance events, often done in like cycling, marathons, triathlons, just to give those athletes an extra boost. But the side effects of blood doping are can be deadly. They increase the chance of blood clotting, increase the chance of heart attacks and heart disease, and as well as strokes. So these can all be very deadly. Like on the screen here, we have a picture of a blood clot. So this blood clot, depending where it is, it could be in the brain or it could be in the heart, which could lead to heart attacks and strokes and possibly death or serious injuries. Next is beta blockers. So beta blockers work by blocking the body's adrenaline receptors. This lowers blood pressure and allows for steadiness and focus in sports. The thing about beta blockers is that they are allowed in certain events. Um, they're really popular in sports as in such as archery. as they require steady hands, or also like riflery or any shooting sports. And they are also used for heart attack prevention, angina, heart arrhythmias, tremors, migraines, and many others. So they are allowed during competition only for specific events with like a medical prescription. But they still do have dangerous side effects. These include dizziness, weakness, drowsiness, fatigue. It can have cold hands and feet, dry mouth, skin, eyes, headaches, upset stomachs, diarrhea, or constipation. The final drug we will be talking about are glucocorticoids. Um, they are a steroid hormone produced in the adrenal glands of the body, but can also be synthetically formed. It is a hormone that reduces and stops the inflammation process. Athletes may take these to mask an injury to allow for further competition. This often leads to further injuries as well. So these ones kind of relate back to the narcotics and cannabinoids in the way that it's used to reduce the pain. The side effects are um, increase in blood sugar, suppressed ability to absorb calcium, increased cholesterol, increased risks of ulcers and gastritis, delayed wound healing, loss in muscle tissue, and can also lead to Cushing syndrome, which is a metabolic disorder caused by overproduction of corticosteroid hormones by the adrenal cortex. And this often is involved in obesity and high blood pressure. So these can be very, very dangerous and really harmful to our health. Thank you for watching our presentation. The worksheet that you completed will be helpful for future tests or exams and just kind of to help you wrap your brain around it if you missed anything. And now it's time for the Kahoot quiz. So good luck on that, and we hope you enjoyed it.